This is one of my favorite topics, and that is someone will often come and they'll want liposuction. And I look at them and I say, I think you need a tummy tuck. And so, how do you decide whether you're a candidate for lipo or the surgical tummy tuck? And it's really relatively straightforward. Okay, so chances are, if you've had children and you're over the age of 15, you will likely have some muscle separation and likely have some extra skin. And so, we'll talk more about the surgical options. Liposuction is a tremendously powerful tool for tackling stubborn fat deposits outside of the fascia, so outside of the abdominal organ space. Um, but in someone that is otherwise has good skin, not a lot of excess skin, and if we're talking about the belly region, we're talking about someone where the muscles are otherwise together. I have seen many patients who've had multiple rounds of liposuction by someone else or multiple someone else's. Their muscles are separated. That might be known as a diastasis, and it is known as a diastasis. But but liposuction will never bring those muscles back together. To do that, you need a needle and thread. So I tell patients there's three tissue types of the belly that we concern ourselves with: skin, fat, and muscle. If the problem is just fat, lipo is a great answer. If there's excess skin or muscle separation, we're going to talk about the surgery. Now, of course, if someone decides that all they want is the liposuction, that's okay. But in terms of my job of managing your expectations, I need you to understand that liposuction in general will do nothing for the muscle and will likely do very little for the skin depending on the person's circumstances. There are occasions where you can see some skin retraction, but as a general rule across all patients, all skin types, all age groups, if there's excess skin, hanging skin, loose skin, there's muscle separation, we're going to talk about the surgery. Hope that's helping your decision making.